Access to medical kit is key to the continent's efforts to tackle the coronavirus pandemic. From masks to respirators to personal protective equipment known as PPE, the continent's now competing with other regions in the world for the tools it needs to equip medical staff and treat and test patients. Engineers and students at African universities have been quick to rally to the call for solutions and do what they can to literally come up with the goods. I spoke to Dr Ahmed Shaikh from the Regent Business School and asked whether, compared to China, the US or Europe, there's anything different about the difficulties Africa is facing in getting the coronavirus kit it needs.
We had the first infections recorded from a group of South Africans who visited Italy somewhere around the first week of March. So I think when we started picking up infections in many African countries, by then the global supply chains were quite severely disrupted, starting sometime in January probably, with China picking up infections even in December. So I think that when the infection rate sort of started picking up in Africa, by then global supply chains were disrupted or closed down, and we had no real opportunities for countries in Africa to acquire any significant quantities of PPEs. By then borders had closed, lockdowns were in place, etc. So this probably is the difference that we've had in Africa as compared to the shortage of PPEs in Europe and America and the East.
And so what kind of solutions has the continent seen, or what's been offered to try and make up the shortfall in the kit that they need?
Thank you very much. I think there's an interesting flurry of innovation, if you like, across South Africa and many other African countries in our perspective. From my own institution, which is part of the Honoris Network, we've had to rapidly pivot our research innovation agendas, if you like, or repurpose it to be able to respond to this global pandemic and its impact on African countries. If you like, it's our own version of doing triage, as people say in the healthcare fraternity. So we've had to say, look, this is what teaching and learning must do, and this is how our research and innovation agendas has to be re-engineered or repurposed. So across the Honoris platform in many universities on the continent, we've had the opportunity of bringing together staff, faculty, students, our partners and collaborators to be able to rapidly build simple, inexpensive and scalable solutions for PPE across Africa. For example, in my own institution, Regent Business School in South Africa, we've had the benefit of access to 3D printing technology in our maker spaces called the iLead Lab, and we've been able to manufacture 3D print splash protection masks, face shields, and we've been distributing these free to frontline healthcare workers and first responders across all the major cities in South Africa, and we've also sent these to Southern African countries neighboring South Africa. So we've got maker spaces across all our learning centers in the major cities of South Africa, and that's one solution we have had as a university within the Honoris Network. Just to give you another example, in North Africa, our partner universities in Tunisia in particular, they put together a team of scientists, doctors and engineers, and they've prototyped and built a respirator to aid breathing of COVID-19 infected patients. And they've done this with a very simple, open source, scalable solution, and they've made it available widely to other industries and other institutions to build. If I had to give you a quick third example, in Morocco, our partner institutions in Casablanca, some of the leading engineering universities are part of our network, and they've had participated in a hackathon for the whole of Morocco. And some of our students, faculty, had come up with some interesting solutions. For example, our students in Morocco had built a drone that was able to deliver testing kits to rural areas across Morocco, and they're able to get back these drone samples of testing kits, pass it through a disinfected location and then into a testing center. Another example in Morocco is we've built some smartphone technology that doctors and healthcare workers can use to track COVID-19 patients. So I think there's been a flurry of innovations within our own network of Honoris and certainly across many universities in South Africa and Africa. And I think that these are the kinds of repurposed research agendas that our sector, tertiary education, has been able to engage with, and we've been able to respond to the global pandemic and, of course, the shortage of PPEs.
Well, bearing that in mind, do you think that that suggests that universities will perhaps going forward play more of a role in terms of driving innovation on the continent, and that they'll get the support they need to be able to do so?
I certainly think so. I think there's, quite frankly, a renewed vigor. There's a new energy at universities and our own institutions. And we've always maintained this notion that universities are hubs for social innovation, social entrepreneurship, teaching and learning and research, not just for research's sake, but for social impact in communities. And I think what COVID-19 has done is presented, if you like, a golden opportunity in the midst of a terrible crisis for universities to rethink and reimagine what the research and innovation budgets and agendas are needing to be. So I'm really hopeful.
Dr. Ahmed Shaikh there speaking to me a little earlier on. Well, that's it for Eye on Africa. Thanks for joining us. Do so again if you can. Take care.
Versailles.